This is an incredible story. So I didn't realize you were already working in healthcare at Oracle when this
Yeah.
all happened.
Yes. Yes.
Wow.
I had, I was, when I went into surgery, I was about 15 years into my career
Wow.
leading efforts in the foundation, which at that time was Cerner Charitable Foundation, First Hand Foundation, and went to a different name as we moved into Oracle. But it was so interesting that, for years I was working with this company, digitizing healthcare to improve the experience for the patient. And then I was also, advocating for these kids through fundraising in the foundation to get them the help they needed, and then having to experience that myself. When I tell my story, I talk about in a frame that, when I got that diagnosis, one thing that I learned was that my tumor had been growing. It was slow growing, and it had been growing for 8 years, which meant during that 6 years, and I visited the doctor 109 times, it could have been caught every single time that I went if I would have had the appropriate scan. And that I did have a head scan. And the head scan that I had, that was about a year and a half prior to that, the person that read that scan didn't see the severe misalignment of my brainstem. And so
Wow.
that was a human error. And so it's complicated because there's a lot of movement that we're making to better healthcare, and healthcare needs to be better on so many different levels. And so that's actually where I feel so passionate about now, this work we're doing and combining the efforts that I've been part of for so many years, and now with the power of Oracle, is because it's so well rounded. It's fixing it at all levels that I truly believe will change it for the patients and patients and physicians in the future. And so I think that's where I pour my heart and soul in, because I do not want anyone else to experience years of unanswered questions. And then, but one thing I also say is that when I get to my story where I find that doctor in Chicago and I get to that doctor in 4 days, I mean, that's a clear and cut story of health equity. I had resources.
Mm-hmm.
I was able to get on a plane, get a sitter, like have my kids taken care of. That's the care everyone should have.
Yeah.
Everyone. And so I can't imagine if I wouldn't have had those resources at my
Yeah.
fingertips, where I
Yeah.
would have.
It's amazing how these experiences show us our privilege in a way, and
Absolutely.
that in those prior years, your privilege didn't even really matter. It didn't get you the diagnosis any sooner, I think.